youth demographic dividend and skill census. Recently you have started speaking something which is going to be phenomenal for the country like India, where the workforce is going to be absolutely beautiful, sir. But sir, last 1.5 years I've seen you talking about one very important thing that no other leader has spoken about. You started talking about longevity of the people, personalized healthcare, which no other leader has spoken about, because always leaders speak about sick care. When people are sick, that is when you give the access to the health care. Sir, you started talking about this, and I'm sure that something is very big around the corner that you're talking with the Gates Foundation. Inspired by you, sir, we have started a company called Ayu AI, which is going to bring a great benefit by giving 360-degree view to the doctors about the patient, where genomic data will also be combined. The people are going to benefit out of this, sir. Just for the context, United States is losing 20 billion every year and 400,000 people every year, sir, just because of the medical and diagnostic errors. This is the global solution that we are addressing, and we would like to start this global challenge from Andhra Pradesh. We'll see you soon with the proposal, sir. Thank you so much, sir.
No, I'm very happy. This is a very good point he raised. Always Ramdev Baba used to say one thing. God has given for human beings 120 years life. But we are eating within 40 years what we have to eat 120 years. That is the biggest challenge. That is where our friend has rightly mentioned we are preparing a project now. Digital health records. Gates Foundation, Bill Gates promised me, he will bring global knowledge and also global technologies. Now TCS is working with me. We already have completed one constituency district we are starting. Within 2 years' time, we are going to complete this project in Andhra Pradesh as a pilot. It is not only my state. That is what Gates asked me. I am trying so many states, nobody is able to do it. If you do as a pilot, then I can scale it up for India. After that, I can take to other countries. The main features of this project, one is preventive health. Every quarter, that is what we have started, diagnosis reports. Nearly 45 to 50 parameters we can test at his doorstep. On the basis of that data, we can prescribe food. What is the nutrition they have to take? Then nutrition, always I feel, kitchen as a pharmacy, food as a medicine. If it is not curing, then you have to take medicine, go for nutraceutical. Then it is impossible to cure with that, go for pharmaceuticals and operations. That is the order we are preparing. Now I wanted to promote yoga also. For always health, healing centers, even every religion. Hindus will go to temple. Muslims will go to masjid. Christians will go to church. There they are getting strength, energy, stress buster, everything. And also yoga. Recently we conducted yoga in Visakhapatnam. 11th Yoga International Day. Morning 5, they had to come by 5:30. More than 310,000 people have come, world record, and they practiced it. The strength of yoga, even Guinness record, we are able to establish. Now I want to make it yoga as a part of their life. At least half an hour, 1 hour, if they do yoga, then they can have better life. Indian medicine also, I want to integrate everything, knowledge. And also I want to go for disease profile. 10 diseases are contributing 85% of diseases. Either cancer or diabetic or hypertension and nervous, everything. Neuro problem, these are all the problems, heart problems, all these problems. Now I wanted to study further backward integration, how to cure them. There, as rightly mentioned, genetics test also you can do it, how to take actions, various things. Now wearables have come. Now I am having ring, Aura ring. Morning I will see, after getting my sleep, my readiness, my sleep score, my heart rate, everything. I am dull, I will have half an hour more sleep. Or otherwise I will get up and then will work. Now ultra-human patch has come, sensor has come, real-time glucose level you can monitor. Even heartbeat you can monitor real time. So many wearables are coming. It is coming cost effective. Tomorrow, no need to hospitalize everybody. If necessary, we will pick up. There are air ambulances now. Helicopter ambulances are coming. Ambulance is coming now. Within half an hour, we can take him to hospital. So this is where we are thinking. Real-time monitoring, preventive health, and also curative at cost effective. Diagnosis is the biggest problem. Some problems, disease is one, infection is one in hospitals. Disease is one, diagnosis of the doctor is one. Wrong medication, that is another. All these problems are going to cure with artificial intelligence. Sometimes quantum computing has come. I want to go for personal medicine. That is where backward and forward integration, if you can do, lot of things we are going to achieve. That is the project we are starting. I named it Sanjeevani. That project name is Sanjeevani. You are all aware in Ramayana, Lakshmana was unconscious. Then Rama was worried. Then he asked how to save him. They suggested Sanjeevani plant. Hanumantudu, he don't know what is that. He went there. Good intention. Then he brought one mountain. In that mountain they identified Sanjeevani. That is how they treated, they saved Lakshmana. This is where I wanted to bring global knowledge to the doorsteps of the patient. That is where Sanjeevani, with artificial intelligence, with knowledge, which medicine, which knowledge, medical knowledge will work for him, we are going to apply. That is a game changer. That is the beauty of artificial intelligence. That is going to happen in future, not only one field, either agriculture, even health, education, tourism, everything. This is where I am saying, all of you, life has become very easy, very inspiring. One cell phone is enough. You can go and live anywhere. You can work anywhere to anywhere. That is going to happen in future. Thank you.
Thank you, sir.
Good evening, respected Chief Minister. Sir, as my leader of IBPC has rightly said, you are a real CEO. And one important thing that I am requesting from your side is to help my city of Kannur in Kerala. We have a beautiful airport there. And the Civil Aviation Minister was approached to give us the point of call order. And he was saying that I am helpless, even I am not able to convince the central government to give the point of call order for Amaravati and Vijayawada. He is saying that I will be very happy if Kannur gets it, but even I am not able to convince the Prime Minister. We feel that you are the leader who can make it happen. And if you can make it happen, my city will also benefit. We are a town of export excellence for textile exports. We have got the National Institute of Fashion Technology of Kerala in Kannur. We have got one of the best airports in the country since the last 7 years. But we need your help, sir. Thank you very much.
Yeah, that problem is there. Long back, you know very well, Emirates. I used to go to so many places at that time, asking them to come to Hyderabad. They used to ask me, first of all, at that time, they used to ask me which Hyderabad. Pakistan, there is one Hyderabad. Then I used to say, India, this is Hyderabad. Now, Pakistan, Hyderabad is not that popular, but India, Hyderabad is very popular now. Then I used to ask them to come to Hyderabad. Then they used to say, how to come to Hyderabad? Come to Delhi or Mumbai, stay night halt, and then morning catch the flight and then come back to Hyderabad and then complete business, go back. Then they used to ask me one question, why should we come to Hyderabad? We'll complete business in Bombay and then we'll return comfortably. That is how I fought at that time. Open sky policy has come. That is where Emirate flights, as on today, how many flights? 1,200 flights per week. Before that, very nominal 1 or 2 flights. That is how we brought it. Today there is a problem, technical problem. Even today all of us discussed about it. Tomorrow we are meeting Emirate chairman also. I'm going to work it out and then let us see how it is going to progress. It is a country to country. We have to convince, we will work it out.
Thank you, sir.
Various alternatives will work it out.
Thank you very much.
Thank you.
Sorry, just one question here. Honourable Chief
Thank-
Minister, thank you for... sorry, I just have one question. here.
1 minute, 1 minute.
Thank you, Honourable Chief Minister, for an excellent presentation and to your delegation. It's been a very interesting day for us here. My name is Joseph McCaffrey and I'm the CEO and founder of DMC Global Partners. We are a data centre developer and manage data centres across Europe and more recently in the Middle East. We've been speaking to your colleagues today with great interest around the data centre industry and the proactiveness of your region to build data centres, particularly in the dawn of AI infrastructure. But a question we have really is around power certainty, grid connections, and the reliability of power is a huge issue before we can bring investors to the industry to get them to commit. So land is one thing, for sure, but power and the grid connections and the reliability and the quality of the power is a huge issue before the data center industry invests in a very serious way. So it's a very brief question. I know it's a very technical subject, but just around the commitment to provide power at scale for AI infrastructure growth. Is that appetite there for this region, and is the infrastructure there in the next short term, in terms of the next 3 to 5 years?
Yeah. I'm very happy your question. I wanted to straighten this, inform you. Long back, I started power sector reforms. In India, around 1999, I started power sector reforms. Everybody used to afraid of touching power sector. If you attempt power sector reforms, it won't be successful. Even Orissa started earlier power sector reforms, they failed. Then I started. Then I made successful. First regulatory commission, transmission, generation, distribution companies, we have unbundled and we are able to implement successfully. Even long back, controlling on and off from remote. That is where 20 years back I had done. Today technology has come. You are having any